There's a new breakthrough in cosmetic surgery called the Endoscopic Browlift. And it promises to get rid of bags, wrinkles, and crow's feet. And believe it or not, it's supposed to be quick and painless. Yeah, right. The last time I heard that, I lost my virginity. And here to explain the new technique is cosmetic surgeon Dr. Thomas Romo. Welcome, Doctor.
Thank you, Joy. Thank you very much.
Okay, tell us what the endoscopic surgery is.
Well, the endoscopic brow lift is a procedure that's used to rejuvenate the eyelids and the brow without cutting out skin around the eyelids. And there's a description, kind of an illustration. It shows that there's a natural elevation of the brow, and what happens as we age is that falls. The surgical procedure consists of making these very small incisions in the hairline and not cutting out hair or skin. And what we do is under the skin, we elevate this tissue and free it up under the skin, again, not cutting any skin or hair out, and then we come and suture fixate this tissue back up in a natural elevation, eliminating the extra skin and reducing the crow's feet.
So before they would have cut around the eye?
Before they would have cut around the eye, which gives you eyelid closure problems.
So what are the risks? There have to be some.
Well, risk in all surgery. Infection, you give antibiotics, and we get them off of aspirin to prevent bleeding.
Okay, we brought two women here, right, that had this particular procedure. The first one is Catherine. Can we take a look at this? Is her before.
5 weeks ago today, they had their surgery.
Okay.
Okay, here she is in the morning.
She's quite drowsy.
Drowsy. She gets up in the morning, she looks in the mirror, and she doesn't like the position of her brows.
Yeah.
She has these, what we call crow's feet out here, extra skin on the upper eyelids. The brows are too low. This upper eyelid skin, they can't put their makeup on in this area, and again, the classic crow's feet.
So what did you do for her?
Okay, well, she had just an endoscopic forehead lift. Sort of graphic, but again, it's very limited. Small incisions made up into the hair, no hair taken out, no skin taken out. It's very quick. It's less than an hour to do, and we make these little small suture fixations here. We close this up. Again, no hair out, no skin out, so you don't have closure problems. We all get dry eye syndrome as we get older, so you don't want to have any closure problems. And then a simple closure.
Okay, and then how long for it to heal?
Well, usually about 3 to 4 weeks. The girls are, within 10 days, the girls are out ambulating and they look fabulous.
Can we take a look at Catherine today then?
Catherine's actually here today, so, and here she is 5 weeks after surgery.
Oh my gosh.
And here she is.
She's quite pretty anyway.
Quite pretty.
Yeah.
And she looks outstanding, she looks youthful, and she has no eyelid closure problems.
How long did it take to heal?
Well, we asked her. She's 5 weeks out.
And how are you feeling now? Did it hurt? Was it great?
Just for a couple of days, but in about a week I was out. That was it.
That was it?
Yes.
So you're really great. Glad you did it. I'm sure,
yeah,
100%.
very glad.
You look great.
Thank
really
you.
Wonderful. Okay, the other woman is Deborah, correct?
Deborah, absolutely.
Right.
Okay.
Now, this is her before.
Now here's Deb. She gets up in the morning, she looks in the mirror, she looks like she's been out partying.
Now, how old are these ladies, by the way? How old is Deborah?
Deborah's in her late 40s, and Kathy's in her late 30s, early 40s. Okay, so she's got bags under here, extra eyelid skin. What happens is they get a collapse of this skin, and it collapses here and thickens the area of the nose. So what we did on her is the endoscopic forehead lift, not taking any of this skin out, and we took the bags out through the inside, not taking any skin out.
And again, the same healing process, about 4 weeks. Whatever.
Exactly.
And can we take a look? Oh, I'm sorry, go ahead.
No, in fact, she is 5 weeks ago. Today, she had her surgery as well. I did both of these women here in New York 5 weeks ago.
Deborah, why don't you stand up? We have you here as well. Take a look at this one. Wow.
She looks great, too.
Yeah. Thank you.
Here she is. She looks in the mirror in the morning. She has no eyelid closure. Postmenopausal women have more dry eye syndrome, so you don't want to have problems closing your eyes. You don't want to take skin out from around the eyes anymore. So she had the endoscopic forehead lift and an internal approach for the eyelids, and she looks fabulous.
And will this last forever?
If people live forever, it would. But it usually lasts about,
That's cute. I told you. He's cute.
15 to 20 years.
I'll handle the jokes, okay? Do you like it? How do you feel?
Absolutely. You know what? Instead of doing this now, as I was getting, now I'm doing this. It's fabulous.
Yeah, yeah. I know somebody. I was reading about someone who had like 4 or 5 of them. Famous person.
Well, in the old days,
but not this type of thing. A forehead lift, so her eyebrows are like up around her hairline.
Wow.
Exactly.
It's not attractive. What does this cost?
It costs about $4,500.
$4,500.
Not too bad. I mean, you save up a few years, and then you could do it.
Exactly. Right.
Start saving when you're 20, though, because you'll need it at 50, right? Thanks so much, Doctor.
Thank you. Thank you very much.
Thank you, Doctor.
Thanks to Dr. Thomas Romo. And if you'd like more information on endoscopic brow lifts, log on to our website. We'll be right back.